Hello, the topic is obstructive sleep apnea in children. That means the child during sleep, he does not get a normal sleep because there is some obstruction in the upper airway, and because of the obstruction, he doesn't get normal oxygen in the body. With every cell needs oxygen, and this affects the brain, heart, lungs, and so many other organs, mainly these three organs. So, in this third part video, total I have 5 parts. The first part I have told, that is the introduction part. I have told about sleep apnea, the terminology, important words to be used, what are the different types, classification, grading, and causes. The second part I have dealt with the mainly the patient complaint. Mainly this is a child, so the complaint comes from the mother, and the examination finding. Here in the third part, I am going to tell you mainly about the investigation. I have already mentioned that the commonest cause of obstructive sleep apnea in children, it is adenotonsillar hypertrophy. So, adenoid means it's a enlargement of the adenoid which is seen behind the nose in the part called nasopharynx. And tonsil here behind the tongue, one on each side, that can be hypertrophied. This is the commonest. So, in this condition which comes together, adenotonsillar hypertrophy, here the investigation is going to be very less. One X-ray to rule out adenoid hypertrophy, one nasal examination, and just direct examination tonsil. But here in this part, I am going to tell you the third part, all the investigation related to obstructive sleep apnea, not only this cause. So, the commonest cause being adenotonsillar hypertrophy. So, let me come to the investigations. So, investigation, I will start with X-ray the postnasal space. Here, if you see this X-ray, you can see adenoid hypertrophy. I will show you. This one, this bulge which you see is adenoid hypertrophy. Next one, I will put in an endoscope and have an examination of the to see whether the adenoids are enlarged or not, and if it is enlarged, what percentage obstructs the nasopharynx. That is second. Now, coming to the next one, that is pulse oximetry examination. This is the simplest available test from which I can come to know the child has got a sleep apnea. So, when we use this pulse oximetry and during sleep, we will tell the parents or the mother to have a look that oxygen saturation, it goes by how many percentage. So, with this definitely we can come to know whether he has got a sleep apnea or not. But there are so many other criteria which we need to know. So, the main investigation choice or the test of choice is going to be polysomnography. For this test, the child need to be admitted for one night. So, they come to the hospital say around 7 o'clock, and we have a sleep lab where we do sleep study for the adults and child. And in this sleep lab, when they come by 7 o'clock after dinner, say 7 or 8 o'clock, there will be so many wires which will be connected to the scalp or the head, and few wires in the face, and though all these wires will be fixed to a small gadget or small box which is just bigger than a pencil box, it will be tied around his stomach and the abdomen. And with this, all these gadgets, he goes to sleep. That is a normal sleep, that is what you want. So, we want a normal 6 to 8 hours of sleep. In between, if suppose he wants to go to the restroom or comfort room, that is fine. We will come to know that part will be neglected. And all this during the 6 to 8 hours of sleep, and we will be recording so many things. From that, we will be checking how much of oxygen level goes down and how many times it goes down, whether it got secondary effect in the brain or not, and how many times his sleep stops, or if suppose it does not stop, it just comes down, how many times it comes down, what is the percentage of oxygen drop, and heart rate, how many times it varies, whether it decreases, increases, or it happens more, and how many times it happens per hour, and we will calculate the whole night also. Likewise, the respiratory effort and respiratory rate, everything together. With that, we calculate first we see whether he has got a sleep apnea or not, and the severity of sleep apnea. We cannot come to know the level, but everything else other than the level we can come to know. Of course, we can say whether it is central or peripheral. So, that is the investigation choice. Now, the next test, drug induced sleep study. Here what we do is, we take the child to the OT, and the anesthetist gives a anesthesia gas in such a dose that he just dozes off to sleep. And at the same time, I will put in an endoscope to have a look at this nose, just behind the nose, that is nasopharynx, and the tongue, base of the tongue, as well as the tonsil and the oropharynx, and the upper part of the larynx also. And when he sleeps, that is near simulating the normal sleep, almost normal sleep, near normal sleep, I like to know he has got obstruction or not, which level, it is single obstruction or obstruction at 2 or 3 different levels of obstruction. That is drug induced sleep endoscopy. Then we have something multiple latency test. That is not a routinely done test, it is mainly to diagnose a condition called narcolepsy. Now, send MRI scan, which I just included for the name, for the completion's sake. Usually, I don't do it unless it is really necessary. Now, in a child where there is a history of sleep apnea for a prolonged time, and he has got, suppose on examination I come to know there are secondary effects in the body, secondary effects in heart and lungs, then of course I like to refer him to a pediatrician, and they will do cardiac, they would like to know the cardiac and lung status with the help of ECG, chest X-ray, echocardiogram, pulmonary function test, and to include thyroid function test. Now, 2 more tests I would like to include, because there is one condition which produces sleep apnea, or I can say disturbed sleep, which is called as periodic limb movement. The child keeps on moving the limb. Actually, there is no obstruction in the upper level, airway obstruction. This condition usually results because the vitamin B level is B12 level is very low, or maybe he has got little blood sugar, high blood sugar level. So, I would like to include these 2 also. So, these are the main investigations. So, polysomnography is the golden standard of diagnosis, and we don't do this polysomnography for all the patients. When you suspect sleep endoscopy, when there is adenoid hypertrophy, tonsillar hypertrophy, straight off we don't say we need a sleep study, no need. See, when the commonest cause being adenotonsillar hypertrophy, where I have already told some simple X-ray and endoscopy and examination of tonsil is more than enough. So, what are the indications of polysomnography? 1. Persistent complaints even after the tonsil or adenoid has been removed. Second, there is excessive daytime sleep which we cannot contribute to any condition. Third, we are suspecting central cause of sleep apnea. Fourth, the syndromic child with complaint with disturbed sleep. Fifth, adenotonsillar enlargement and the child is very obese. Before subjecting him for surgery, I would like to do a polysomnography to show them or tell them that, see, he has got this problem and you are not going to improve much unless you are going to reduce the weight. And last but not the least, there are so many indications, but I have just named a few common ones. The orthodontist or the maxillofacial surgeons or endodontists, before doing orthodontic procedures, any type of procedure, let it be appliance or splint or any surgery, they would like to know whether the upper airway is normal or not. So, at the same time, not only that, they would like to know when they send the patient to us and the patient complains of, or the mother says the child has got sleep disturbance, of course we would like to include polysomnography also. So, and multi-latency test I have already mentioned, it is mainly for a condition called narcolepsy. So, these are the investigations required for a patient suspected of sleep apnea. So, please do watch the 4th part where I will tell you the complications related to sleep apnea. Thank you so much.